Hello, everyone, and welcome to this episode of Hilantra. Our guest today has over 15 years of experience as a physiotherapist with master in clinical and sports nutrition. She follows an integrative approach through nutrition and exercise to help her clients find the root cause of their symptoms. She focuses on treating chronic pain as well as inflammatory and gut disorders. She does so by educating her clients about the importance of creating lifestyle changes to achieve optimal health. Our topic today is lifestyle transformations to thrive beyond chronic pain, and I would like to welcome our guest, Sandra Serrano. Welcome, Sandra. I'm so happy to have you here with me.
Thank you very much, Rasa, to give me the opportunity to participate in your podcast and explain to people what is the chronic pain and how they can improve their lifestyle through the health and understanding what is the chronic pain.
Perfect. So let's start by you telling us a little bit more about yourself and why you chose this path of physiotherapy and nutrition.
Well, I like human beings since I was a child, always. It was clear for me. And then when I became older and older and I have to choose in which university to study, since always I like the human movement, the emotions, the art, the culture. Since then, that's why I didn't choose medicine, but I chose physio because it was more focused on the skeletal system. It was very clear for me, something related with the human being and health, since always. After that, when I finished my university physio, I wanted to work with or closer in hospitals with doctors. So that's why I continued studying nursing for another 4 years, while I was as well studying osteopathy to complete the vision or the global vision integrative approach of the human being, not only from the mobility or motions, but as well what is happening in our neurophysiology, or more in detail into the medicine. That's why I complete osteopathy and nursing. But I wanted to continue with my physio practice, so I didn't practice as a nurse, but it gave me an idea and knowledge how to implement more pathologies, disorders, to understand how it was reflecting our physical conditions. Then I moved to Dubai in 2015, and I was thinking there is still one piece missing all this. So I started to decide as well to implement the nutrition part as a part of the healing process. So I started a master in Madrid for another 2 years until in 2017, I started to implement this practice to my physio treatment as well. And that's why I came into more focus on integrative approach, in a holistic approach, not as a normal physio, but as a global vision of everything. Since the last 7 years now, I started to work more or closely to preventive doctor medicine to understand better the physiology and how people, they were reflecting physical symptoms along with emotions, social, nutrition, food patterns. To have a better approach in my treatment with that, since now I'm focusing just on preventive medicine, holistic approach, and giving a lifestyle changes according to the individual needs. But this is more or less my career and how I focus until I become now, starting from a physio point of view. So it's not only the movement, it's the mental part, the food part, the social part, and from that to make a good diagnosis along with the doctor.
Yes, I have a testimonial myself because I came to see you, Sandra, for a session, and it was a really, really holistic session, I might say, because we not only discussed at the time I had pain in my upper back, and we not only discussed that, but we talked a lot about other things. We talked about my lifestyle, what I eat, my sleeping patterns. I am a witness of the way that you work. That's why I'm actually really excited to have this talk with you today. I learned a lot of things during that just one session with you, and I'm sure our viewers and our listeners will have a lot to learn as well from this conversation today. So let's start. Let's talk about misconceptions or myths around chronic pain. So when people come to you with pain, what are things that they think or they've heard about that, you usually correct them or tell them, no, this is not the way it is. This is how chronic pain starts, and this is why chronic pain develops. Let's talk about that.
We have to define about what is chronic pain or persistent pain. When people are coming to the consultation, they say they have pain more than 3 months, we consider it a chronic pain. But the main myth in that is people associate pain with tissue damage or any structural damage on the body, when it's not that. The pain is produced in the brain area. This is a fact, and this is what the people they need to understand. It's true when we have any acute pain or trauma or injury, okay, the healing process can be up to a few seconds to 3 months. After that, there is no any tissue damage, and we consider is a structural change in the nervous system. So the brain, they keep thinking there is a potential danger in our body, and they keep sending signals to the painful areas when it's not about that. From that, we need to understand there are physiological factors, neurological factors, emotional factors, lifestyle factors that can aggravate the pain sensations. So if the people they don't understand this, it's impossible to move forward. The pain is caused in the brain area. There are certain brain regions that they are responsible to increase or to modulate the pain sensation. So if I touch my skin and it's painful, if the brain perceives there is danger, he will increase the pain perception despite not having anything. But we need to understand above 30 years old, 80% of people, they have any degenerative process, which is not correlated to pain symptoms. So if any person has pain above 3 months, we need to consider there are other factors in our lifestyle that can aggravate the symptomatology of the pain. And this is part of the pain education. Why this is happening? Because in our body, in all our body, we have different detectors. These detectors, they are responsible to inform the brain that there is danger there. Okay, sprain, when we bend our back, when we hit our body, these detectors, they are responsible to say, hey, there is some potential or dangers here, danger here. Then the brain, they activate as a normal protective response. How? With pain. Mm-hmm. But more than 3 months, we consider there is a chronic pain that is not related with any tissue damage, because the healing process is over. This is the main myth. I have pain since the last 10 years. It's because I have some injury in the shoulder. No, it's not about that. It's about there is a change in your nervous system, structural brain regions. They are keep sending pain signalings because the pain wasn't solved at the beginning of the injury. Lifestyle, beliefs, culture, thoughts, memories, misinformation, maladaptive response to exercise. And this is we are going to talk later. But it's because the detectors in our body inform the brain there is danger there, and then the brain thinks, the brain imagines there is an injury where it's not, and keeps sending signals. We only know 4% they are like a severe disease, like a fractures, cancer. Beside that, the rest, the degenerative process is not related with the symptomatology. So depression, digestion disorders, lifestyle, lack of physical activity aggravate the symptomatology of the pain.
Makes a lot of sense. Makes a lot of sense. And it could happen in the same area where the person might have, like you said, had an injury in the past because the brain recorded this.
Yes, the brain perceives there is injury there. Another thing, why people they can feel pain in different areas of the body with no any kind of damage is because the brain start to pay more attention on the painful areas. The more attention he pays, the more detectors are formed. Wow. The more the immune system as well is involved that, the neuroimmune system, and then the more pain is spreading because more detectors are formed as the brain is paying more attention on the painful areas. This is one of the reasons why people they can feel different areas, different body, like a fibromyalgia. The neuroimmune system is involved, the neuroendocrine system is involved, and then the more sensitization of the nervous system. So the nervous system is more active. The brain areas, they are more active. That's why the more pain modulation, the more pain intensity, the more pain sensations in different areas for our body.
So would you say that during the first 3 months after, let's say, a physical trauma to a specific area, would you say that in most cases, the treatment in those 3 months would be different than the treatment after those 3 months?
Yes, because now we need to work on the structural changes in the nervous system. This is the main concept with the chronic pain. And people with chronic pain, and they have more activation of these areas of the brain related to emotions, related to social factors, related to lifestyle factors. There is an increase of fears to move. The people, they start to feel scared to move because of this kind of attention in painful areas. These fears to move increase at the same time the pain sensation, the pain intensity. So it's like a loop. So what we need to do for that, first, pain education. The people, they need to understand how the pain works. And we don't have to forget, any person suffer a chronic pain, they are anti-inflammatory stage. So we have a chronic inflammation to increase at the same time sensation of the nervous system. And as well, this is related to alteration of the, for example, the gut. So you see, now we start to link chronic pain, inflammation. Inflammation, more chronic pain, more structural change on the brain areas that they are responsible for our emotions. So we need to reduce the activity of these brain areas to decrease the sensation of the pain. How? Understanding, observing. Once the person they start to understand, okay, there is no any tissue damage, this is normal, then the brain they start to feel safe. They start to decrease the pain signals. We start to move better. But for that, that's why it's not the same a treatment for acute pain that for a chronic pain. It's completely different. We need to work more on pain education, on lifestyle of the inflammatory process.
This is very interesting. So you mentioned 3 parts. So the actual area where the pain is, you mentioned the inflammatory response of the body, and then you mentioned issues with the gut. And this is the holistic approach that you told me about during our session, that also the way that we eat will start getting in the cycle that you just mentioned. There's more pain, there's more inflammation. More inflammation will cause pain. And now this is going to trigger certain things in our gut and the way our gut is connected to our brain. And then we start reaching out for foods that will increase this inflammation, right?
Yes, because we don't have to forget the people, they are in chronic pain. These people, they are not moving. They feel scared to move. They start to have a sedentary lifestyle.
Yes.
The sedentary lifestyle at the same time increase more the inflammation and impact on the gut. The mood is down, serotonin is down, endorphin is down. Then we start to alter the hunger satiety axis. We start to alter the good bacteria's diversity. So we start to have more cravings, more food calories, and we start to change the food choices. Then we start to change our food patterns to the Western dietary patterns. The Western diet based on processed food, additives, this kind of bad fats, increase the pro-inflammatory substances in the gut, increasing at the same time the sensation of the nervous system. And this is once again is related to the pain experience. This is how nutrition now can alleviate the symptoms of chronic pain. We need to decrease the pro-inflammatory process in our immune system through our gut, through the food habit, to alleviate the activities of the brain areas that increase the pain sensation. So when we start to change the food patterns based on healthy fats, everyone knows, vegetables, fruits, this kind of food alleviate the pro-inflammation. Start to increase the good bacteria in our gut that decrease the inflammatory process, decrease the sensation of the nervous system, decrease the pain experience, increase our mood, increase our energy, increase our endorphins, and increase the connection gut-brain axis to the vagus nerve that is connected with the chronic pain. Because we don't have to forget, as I said before, the immune system, it's involved on the pain spreading. It's part of the inflammation because of this kind of hypersensitivity of the nervous system. This is how, through the education, okay, we need to tell them your food cravings are because your body is inflamed, and the inflammation decrease or alter the food choices. And this is related as well to the stress as sedentary lifestyle. But the sedentary lifestyle comes because people are in pain. And then the people are in pain, they are not able to move, but they keep eating. And they keep increasing the inflammation. So what we need to do first, pain education, understanding the pain, movement, therapeutic exercise. We need to move, yes or yes. But when people are in pain, we need to give them the adequate dose, volume, and intensity to keep decreasing the brain areas that they are related to pain. And it's not easy because the person has to be ready to receive the information with a very open mindset to understand how the body works. That's why postural exercise, awareness exercise, yoga, mindfulness decrease that brain areas that they are related with emotions, mood, and related as well with the chronicity of the pain. So this is how we are integrating the holistic approach in chronic pain through the lifestyle.
Very interesting. That's true. And it makes a lot of sense, right? The more you feed into the cycle, the bigger the cycle gets in all of the areas. And then once you take it to the other side, once you change it, you go to the next parallel, which is health, and you start changing your lifestyle behavior. You start changing the way that you eat, the way that you sleep, everything will start feeding into each other. And then you have another cycle, but it's totally the opposite of the first cycle that you had. That's very interesting. What are these lifestyle transformations that you want to share with us? I know from what you have told me now and what we discussed previously, that it really depends on each person and where the chronic pain is located and what's the background of the person. But maybe you can share with us something that's common that anybody can use.
Yes, for sure. I mean, with lifestyle, we have to talk about the stress, about the sleep, about food, about movement. People in chronic pain, normally they tend to have higher risk of stress, okay? So the more stress, the more chronic pain. The more chronic pain, the more stress. There is a cortisol dysfunction, okay? And the stress axis is altered, completely altered. And we know cortisol increases the sensation of the nervous system. Cortisol activates the brain areas that they are related to the pain at the same time. So we don't know which starts first, of the chronic pain or the stress, but both are related. So first of all, we need to ask the patient, how is your stress level? For sure will be high because they are in pain. And the pain itself is a stressor because the people, they feel limited. Now we don't talk about the structural, the body change. We are talking about the mind change. This is one. So we need to find strategies to decrease the stress level. Once again, awareness. And the stress strategies through exercise. Through exercise, we need to decrease the pain at the same time. So first of all, pain education, therapeutic exercise, less stress, less cortisol, or good regulation of cortisol, less sensation of the pain, more movement, happier, more endorphins, more serotonin. This is one. Another, sleep. We know the people, they are in chronic pain, they have low quality of sleep. And sleep is one of the most powerful restoration of body. Hormonal fluctuation, cortisol levels, and even decrease the sensation of the nervous system. So people, they need to sleep, but they cannot sleep if they are in pain. So first, we need to reduce the inflammatory process with this kind of treatments. Optimal medicine, physiotherapy, therapeutic exercise, supplements, better sleep, less sensation of the brain, less pain, more endorphins, more serotonin, better level of cortisol, more movement, less pain. So this is how we start. If these factors are getting better, digestion will get better. The immune system will be better, less inflammatory process, better diversity of the good bacteria, less sensation of the nervous system, better vagus nerve function. So more neurotransmitters like endorphins that we know they are the best pain relievers. And this is only we can get through pain education, therapeutic exercise, and exercise itself, and the food changing, the food patterns for sure.
And it's a daily reminder. So the person has to be always conscious about every single decision that they make in their life in all these aspects and all these points in the cycle. So they reach out to have a specific food after being educated, then they will know, okay, if I eat this, it's going to add to my inflammation, then I'm gonna choose not to eat it, right? Or if I'm gonna go to bed and I have the chance to stay an hour later watching a show or maybe doing something else, then again, it's a conscious decision of, okay, what's going to be better for me, whether if I just switch off the phone right now, I do something else, and then I go to bed earlier. So these are all small changes and a daily lifestyle changes.
So our main goal as a physios or practitioners or doctors, when we work together, is to make the person independent, to make the person understanding why they are having reflux or flare-ups. Like they need to recognize, because of course, when a person is in a chronic pain, we need minimum to follow them for minimum 4 months. 4 months. So, but as well, the person needs to understand when they are down or they are having a little bit more pain than usual, to recognize which factors they are doing wrong and the reason why the pain is increasing again. This is our main goal as well with the education. Okay, today I didn't sleep well, this is one of the reasons. Today I ate this is one of the reasons. Today I didn't do my exercise, this is one of the reasons. Today I had a little bit of stress or I have a fight with my partner, is another reason. So, because we don't have to forget at the same time, when people are suffering chronic pain or this or any other as the main reason of the pain, there is a strong genetic predisposition. It's part of the genetic as well. So if the people in the family history, they have a history of chronic pain, they need to understand it's part of the genetic, but their environment can change or modulate the pain at the same time. So it's possible to have a life without pain, but we need a lot of effort, patience, a commitment with ourselves as well.
Absolutely. I agree with you. So tell us a bit about this process. So you said the client should follow up with the team of experts and practitioners for at least 4 months. Can you give us like high-level pointers of what this process looks like? So I know that in the beginning you take the history of the patient, and then after that, how do you follow up with them?
First of all, we need to make a good medical history. Me, physios, and doctors. And I'm not talking about MRI or X-ray. This is part because, as I said before, 80% of people we have from 30 years old to start a degenerative process. And if the people they see this or whatever, they will associate, okay, that message with pain. So when people are in pain for more than 3 months, they need to understand the healing process is done. It's about more emotional, social factors, lifestyle factors. So we don't know if there is any kind of hormone disorder, like a thyroid, for example, metabolic disorder, insulin resistant. All these factors aggravate the symptomatology of the chronic pain. We don't know if that person is suffering, for example, a hard divorce. So we need to understand the life of that person first with a good medical history. Once the people, they tell us, okay, I'm not receiving well because I'm having a toxic work environment, for example, I'm trying to get divorced, but I cannot, I'm suffering at home. Then from that, we start with the doctors, hormonal tests, stool tests, how is the digestion, for example. And from my side as a physio, understand pain education. I need to tell them, okay, the pain is coming from this and this and this. Then we need to implement exercise bit a bit, because without exercise, there is no way to improve. And optimal range of motion at the same time alleviate the symptoms of chronic pain, because increasing the blood flow, increasing the nutrients to the muscles, increase the endorphins, serotonin. So this is the process. Follow up with exercise, follow up with the pain education, understanding the process, any supplement maybe, or some medication at the same time, okay? This is how we approach together the chronic pain patients. So it's not only my side, it's as well the preventive medicine or the preventive doctors, because sometimes you don't know, that person has a thyroid issue and the thyroid decrease some hormones, and the hormones is related with the intestinal dysbiosis, and the dysbiosis at the same time increase the inflammatory process, and the inflammatory process increase the sensation of the nervous system, and this can aggravate. For example, imagine that person bend the back and then pain, but maybe the pain is not because of bending, it's because the patient is suffering a chronic inflammatory process at the same time. So this is very complex, but this is how we need to approach. And then following the exercise in case the person doesn't know, teaching them there are no specific posture to do exercise, teaching them how to get rid of the fears to move. They need to feel confident again. They need to fly again by themselves, by understanding, okay, my body is adapted to everything. I can move in every emotions. I'm a young, and this is what I have to do. But it's taking time, depends of the culture as well, depends of the beliefs, depends as well of the surround the people. There are people they are around with the bad habit people. So these people, they need to follow healthy lifestyle people at the same time, because not everyone has the motivation. Sometimes the motivation is not there, but they need discipline. And discipline they get with the people around. We need to remember this: the people in chronic pain or inflammatory process, they tend to be more depressed. So the depression as well is about the people around them. This is the complexity of the situation.
That's true. That's the emotional factor that adds to the cycle that you were talking about earlier. And it's true. And I can say the same thing personally. Years before, I had lower back pain, and then I decided I don't want to squat anymore, because every time I squat, I feel the pain more. And then I didn't do it for a long time.
But this is real. This is real because the brain pay more attention on the painful areas. That's why we need to adapt the movement to the sensation of or the feelings of the patient. until the brain feels, okay, this position of this posture, this is I safe, start to decrease the painful area, and then start to normalize the movement pattern.
Exactly. So once you start feeling safe, maybe I was doing this particular exercise in the wrong way, or maybe I didn't have the right coach to pay attention to different other things.
Yeah, there is no universal, the technique is important, but it's more important the management of the loads, the volume, the intensity, and the program of the exercise. We need to tell people with chronic pain that there are certain level of pain that they can tolerate in a safer area, in a safe area. This is normal, but there is no universal position for everyone, specifically when we are talking for chronic population. We need to adapt the movement to them to feel comfortable, because exercise increase the endorphins, reduce cortisol, decrease the sensation of pain. This is the pattern, this is the program. And for that, the coach, trainers, physios, they need to understand how the pain works. If they don't understand, they are not giving the proper message to the person. And even more, I tell you, the more they pay attention to the technique, the more stress.
That's so true.
My legs, my back, my this. No, the most important is people, they need to feel moving again. They need to feel they are moving. Doesn't matter in which position and with motion. They need to restore again that movement pattern. And that movement pattern will increase the blood flow, oxygen, nutrients, neurotransmitters, hormones. They feel confident, they start to move in other ways.
I agree. I totally agree with that. Can you tell us, with your background in nutrition, what are some dietary recommendations for individuals with chronic pain, some simple lifestyle changes that they can do that will help them?
As I said before, chronic pain is related to an inflammatory process. So we need to reduce the inflammation. We need to restore the immune system activity, and we need to restore the gut function and the good bacteria diversity in our gut. So Mediterranean food, for example, would be easy. We need to focus on good fats, healthy fats, good balance of omega-6, omega-3, okay? So polyunsaturated fats, salmon, bluefish, nuts, avocado. These fats will decrease the pro-inflammatory process related to the chronic pain. Good quality of protein. This amino acid, essential amino acid, will work on the muscle. Vegetables, fiber, antioxidants. We know they increase the good bacteria diversity, improve digestion, decrease the pro-inflammatory process, decrease the sensation of the nervous system. So simple, high quality of protein, as everyone knows, high quality of good fats, high quality of carbs, vegetables, fiber, fruits, that decrease the pro-inflammatory process. As we know, Western diets based on processed food will increase more the inflammation. And as well, the inflammatory process increases food allergies and food intolerances. So we need to pay attention to that, but this is more personalized medicine. So when people are in the inflammatory process, the gut stops working, the bacteria start to not ferment the food properly, we start to increase the food allergies at the same time. So we don't know if gluten, dairy, so this is something we need to personalize and we need to individualize.
It depends. It's individualistic. It goes back to the history of the person, the way that they react to specific foods. Absolutely. It makes sense.
But as the main goals, avoid the processed food, healthy fats, quality of protein, fiber, good quality of fiber for sure, fruits, vegetables, and for sure, I recommend as well, no snacking and space the meals between 3-4 hours to improve the digestion process, because it's related as well with the inflammation. And we need to include as well some calorie restriction or intermittent fasting in an optimal way for each one, because calorie restriction or intermittent fasting, we can say, reduce the inflammatory process at the same time. So decrease the sensation of the pain or the intensity of the pain. This is how nutrition plays an important role in alleviating the symptoms.
That's very good. Thank you for those tips. How about drinks, caffeinated drinks like coffee or tea?
It depends on this one. The caffeine in a healthy population, up to 3-4 cups of coffee, completely fine. Depends of if the person has any kind of or can disrupt the sleep, then we shouldn't drink coffee after 4 p.m. because there is a genetic predisposition for the caffeine metabolism. But otherwise, up to 3-4 cups is fine. But if the person has any kind of digestion issues, then we should look at it in more details with the person. But about teas, infusion, we know jasmine, anti-inflammatory spices like oregano, thyme, for sure, all these decrease the inflammation in our gut. And as well, apple cider, for example, lemon in the morning or in fasting as well, decrease the inflammatory process in our gut. This is more related to digestion process. But yes, it's a help as well.
Yes, that's true.
Sugar beverage, soft beverage, alcohol, it's pro-inflammatory, so increase the pain signals. So if that person can or chronic pain after a weekend and tell me, sorry Sandra, but I drank more than 5 glasses of whatever alcohol it is, yeah, definitely they will have higher risk of suffering the or abdominal pain, muscle pain, or whatever pain in our body. So increase the intensity of the pain.
Wow. And I haven't come across, anybody who would tell you that if you suffer from chronic pain, drinking alcohol or drinking sugary drinks is going to increase the probability of you either feeling the pain more for a longer time or having it become even stronger and more intense.
Yeah, because the same, alcohol is related with inflammation. And people in chronic pain, they are suffering a low or chronic systematic inflammatory process, which aggravate or increase the activity of the brain areas that they are related to the pain. So, but they need to recognize, okay, this weekend, I drank more than usual. I know where my pain comes from.
So it's all about awareness, right? It's all about self-awareness. If you are able to be self-aware, to discuss this with your health practitioner or your doctor, so that they can better help you, because leaving information out, it's not going to help themselves, it's not going to help the practitioner to give the right protocol for the person to follow. And if you're just like going in life and not paying attention to these things, you're not helping yourself either.
That's why we need to make people responsible for their acts. So when they come to me and they say, no, I feel more pain, I said, okay, what did you do? Then they say, okay, Sandra, I know it was my mistake, or I know, I understand. Then we keep working on that for sure, but they are responsible for what they are doing. This is the main goal as well. People, they need to be independent.
What kind of generic activities, Sandra, would you say are recommended for everybody to do, no matter what their athletic levels are, how much exercise they've done or haven't done in a long time?
When we are talking about chronic pain, we need to do exercise that increase the awareness. That exercise can be yoga, Pilates, anything related to body posture exercise, body awareness exercise, body perception exercise. Why? Because this kind of exercise decrease the activity of the areas that we are related with emotions and increase the frontal areas that we are related to with less pain at the same time. Walking as well decrease that activities. Okay, so anything related to the body perception or body awareness, position, and postures. This is one. Second, any kind of exercise increase the opioids or endogenous opioids related to endorphins. And the endorphins, they are the strongest pain reliefs in our body, similar to the medication. Any kind of exercise will increase endorphins, serotonin. We have some neurotransmitters called glutamate that they increase the sensation of pain. So strength exercise to increase our functionality, aerobic exercise to increase the blood flow and the nutrients to different tissues in our body, and body posture exercise to increase the awareness and decrease the brain areas that they are related to our emotions.
Beautiful, beautiful. You just gave everybody sort of like a map or a strategy. If you're willing to add more body awareness, then you can practice yoga, you can practice Pilates. If you want to increase strength, mindfulness. If you want to increase functionality of specific areas in your body, then you go for a more strength training. Yes. And then aerobics is also very important to allow the flow.
Yeah, blood flow and nutrients to the different tissues in our body and increase the endorphins, serotonin. We don't have to forget that. Yeah. And also, for sure, exercise per se decrease the inflammation, improve our sleep, reduce cortisol, reduce our stress, improve our food choices, decrease our food cravings.
We talked about mental and emotional well-being as being part of that cycle. So are there any techniques or strategies that people can use apart from mindfulness that you mentioned before?
I always recommend people to visit psychologists. I think this is the best they can do in case they cannot handle by their own, to give them a strategy, because sometimes we don't know which kind of stress. As a physios, the only thing we can use is a cognitive behavioral therapy or awareness of the pain, just awareness of the pain and observe their bodies. But as a stress point or mental health, this is out of our work, and they need to visit the psychologist in that case to give them the origin of the pain. Where is the origin? Why you are feeling that? From where it comes from? This is my advice to everyone related to the mental health. They need to visit a psychologist. Yeah, because sometimes we feel we are strong enough to recognize what's going on, but we don't know how to handle. And that loop can increase and increase and increase and increase. And from that, it's when we produce more structural change in our nervous system that after they need or they require more time to get rid of that. So the more you wait, the more time to recover.
Absolutely, I agree. And there are different types of practitioners. You have psychologists, you have practitioners who can provide different kind of different healing techniques. So there's plenty of options out there. The person can get educated online or can ask friends or anybody about their personal experience and then try these different modalities by themselves and see how they feel. There is misconceptions also around maybe getting help. So there is nothing wrong about getting help. Just as you go to a doctor when you feel pain in a certain place in your body, then when you feel that you are emotionally or mentally not able to help yourself or you have that kind of pain, then you also should seek help.
Yeah, definitely, yes. And another component I would like to mention that the people, they tend to forget, and it's not the less important, is the social component. We need to be around people. I mean, we need to socialize. We need to make the effort to meet people. We need to break the routine. We need to go for dinner. But we need to choose as well our people. Sometimes people, they are in a toxic environment that they are not aware about, and they are responsible as well to increase that, as we said, the cortisol, the brain area. But it's very important that the people, they choose wisely the people they are around to improve this kind of stage. And this is I encourage them, because sometimes I find people, just weekend, just Netflix, movie, not too much. I feel, no, we need to make the effort. We need to make the effort. That's why we need to visit the practitioners to help them to, or motivate them, or improve the pain to socialize more.
I agree. I mean, there's nothing wrong with taking a day or two and sit by yourself and just take time off, unwind, maybe recharge your batteries in a way that, you know, if you're an introvert, for example. But absolutely, I agree with you. We were created to be able to live in communities, to socialize, to have a social life. And it totally makes sense what you just said. So, you know, we choose our friends and we choose our activities as well. So we don't have to just go somewhere and be miserable, right? We choose our activities the way that we want them to be. What do I like to do? Sit down, maybe in that time that you take off 1 or 2 days by yourself, sit down and make a list of what kind of habits and what kind of activities you'd like to do, what kind of hobbies you would like to start or you already have and you would like to pursue even more, and then find 1, 2, 3 whatever number of people, or maybe one person to practice one hobby with, another person to practice another hobby with. This is very important. You're right. And we tend to forget it because either we are so used to what we already have, and we don't want to maybe be proactive into developing that side of our life or that part of our life even more. But this is a very important point as well.
Yeah, definitely. And people, they need to make the effort. They need to be responsible.
And I believe that anybody at any age can do that. So it doesn't matter how old you are. It doesn't matter at what stage you are in your life. These are changes that are quite doable and achievable at any age.
We know now from neuroscience that we can increase the neuron connection at any age in our life because our brain is so plastic. So there is not any excuse for anyone to change, to do new things, because the brain is remodeling the neurons at all the time. So when we open our mind, we are aware about, we have the information, our brain is ready to change everything in our life.
I agree with you. Do you have any final words of encouragement for anyone listening or watching?
I encourage people that it's possible to live life without pain, but we need patience and we need courage and we need to be ready for that. I encourage people as well to be open-minded, to receive new information, even if that information is not related to what they were hearing before. Science is constantly changing. Science so dynamic. It's so updated all the time, and with the updates, the information, the willing to do, and the proper practitioners, people, they can again enjoy an optimal lifestyle. At the end, this is that it's to live optimally as much as we can, just optimally. It's not being immortal. It's quality to the years. Yes.
I agree with you. Thank you so much, Sandra. This was really insightful.
Thank you very much to give me the opportunity to talk about this. And thank you.
Thank you for tuning in to this episode. We hope you found it insightful and you enjoyed it as much as we did creating it. Don't forget to like and subscribe for more content like this. Let's continue creating this amazing community of holistic wellness seekers and practitioners together. See you in the next one.